In the cold, calculated arithmetic of medicine, there is a limit to failure. If a surgeon steps into the operating theater and everything goes wrong, catastrophically wrong, the worst possible outcome is a mortality rate of 100%. The patient dies. It is a tragedy, but it is a mathematical ceiling. You cannot lose more than you started with, but history is full of anomalies. There is one specific incident, buried in the dusty archives of Victorian London, that defies this logic. It is a case study that sounds like an urban legend, yet it is cited in medical textbooks and historical dossiers to this day. One surgery, one patient, and yet 3 dead bodies. How does a routine leg amputation result in the deaths of the patient, the assistant, and a spectator? Today, we are opening the file on Dr. Robert Liston, the fastest knife in the West End and the bloodiest 25 seconds in medical history. To understand how this nightmare unfolded, we must first transport ourselves to the grim reality of the 1,840 seconds. We are at the University College Hospital in London. Forget what you know about modern medicine. Forget sterile white rooms, the steady beep of heart monitors, and the gentle drift into unconsciousness. In the early 19th century, surgery was not a science of healing. It was a desperate, brutal combat sport. There was no anesthesia. Ether and chloroform were still just rumors on the horizon, not yet adopted in European theaters. This meant that every patient who entered the operating room did so fully awake. They felt the strap of the leather restraints. They felt the cold air on their skin. And, most horrifically, they felt the knife. Because the patient could feel everything, the primary enemy of the surgeon was not infection, not yet, it was time. Pain causes shock. Prolonged shock causes death. Therefore, the mark of a great surgeon was not his delicacy, but his speed. A slow surgeon was a killer. A fast surgeon was a savior. Enter Dr. Robert Liston. Standing 6 feet 2 inches tall, Robert Liston was a titan of Scottish medicine. He was described as abrasive, arrogant, and undeniably brilliant. In an era where a standard amputation could take a localized surgeon 20 minutes of agonizing sawing, Liston could remove a limb in under 30 seconds. He was known as the fastest knife in the West End. His operating room was a theater in the literal sense. Students, distinguished guests, and other doctors would pack the gallery, leaning over the railings to catch a glimpse of the master at work. They came for the spectacle. They came to see human anatomy dismantled with the precision of a magic trick. Liston played to the crowd. He would stride into the room, his apron already stiff with the dried fluids of previous surgeries, because washing a coat was seen as a waste of time, and shout to the gallery, "Time me, gentlemen. Time me." It was a performance. But on this particular day, the performance would spiral into a massacre. The atmosphere in the room was thick, not just with the tension of the crowd, but with the sensory overload of the era. The air would have smelled of stale sweat, sawdust scattered on the floor to soak up the spill and the metallic tang of old iron. The patient that day was a man suffering from a necrotic leg. In the 1,840 seconds, a necrotic limb meant the tissue was dying, rotting while still attached to the body. The pain would have been excruciating, the smell putrid. Amputation was the only option to stop the rot from reaching the heart. The patient knew the odds. He knew that even if he survived the table, hospital gangrene, a rampant infection in the pre-antiseptic age, took nearly half of all patients afterwards. But the table was his only chance. Liston prepared his team. This required strong men. The surgical assistants of the time were often young doctors or medical students whose job wasn't to hand over instruments, but to physically pin the screaming patient to the wooden table. Imagine the scene. The patient is thrashing. The crowd is murmuring, leaning in, coats brushing against the railings. The assistant is gripping the infected leg, bracing himself to hold it steady against the violence of the saw. And in the center of it all, Robert Liston. He draws a long, shimmering amputation knife. He shouts his catchphrase, "Time me, gentlemen." The clock starts. Liston moves with the speed of a striking cobra. In a standard amputation, the goal is to slice through the soft tissue in one clean sweep, exposing the bone for the saw. Liston was famous for using his left hand to compress the artery and hold the limb, while his right hand wielded the knife. He lunged. The knife flashed. But in his desperate bid for speed, amidst the struggling of the patient and the adrenaline of the performance, Liston's aim drifted. It happened in a fraction of a second. A blur of motion that the human eye could barely track. The blade tore through the patient's thigh. That was intended. But Liston was moving too fast. He hadn't accounted for the position of his assistant's hand, the hand that was holding the leg in place. The knife didn't stop at the patient's flesh. It continued its arc, slicing clean through the fingers of the surgical assistant. Blood crimson and hot erupted from two sources instantly. The patient's leg was severed. The assistant's fingers were rolling on the floorboards among the sawdust. But the momentum of the fastest knife was not yet spent. Liston, caught in the follow-through of his stroke, swung the knife upward to clear the table. He whipped the blade back with such ferocity that he clipped the coattails of a distinguished elderly spectator. This spectator, a gentleman of high standing, had been leaning in too close, eager to see the master work. He felt the tug at his waist. He saw the flash of steel. He looked down and saw a spray of red fluid splashing across his clothes, fluid that actually belonged to the patient and the assistant, though he did not know that. The spectator's mind raced to the only logical conclusion. The mad Scotsman had gutted him. Overwhelmed by the sheer horror of the scene, the screaming patient, the maimed assistant, and the belief that he himself had been sliced open, the spectator's body shut down. His nervous system collapsed into neurogenic shock. He collapsed onto the floor of the operating theater. Before anyone could even check his pulse, he was dead. Cardiac arrest, induced by pure, unadulterated terror. Body count, 1. But the tragedy was only beginning. The surgery, technically, was a success. The leg was off. The patient was bandaged. The assistant's hand was wrapped. Liston had finished the job in under 28 seconds. But the Grim Reaper was merely waiting in the recovery ward. We must remember the environment. This is 1840. Germ theory is decades away from acceptance. The knife Liston used, it was likely wiped on his stiff, bloody apron before the surgery. The hands that bandaged the wounds, unwashed. The hospital air was teeming with invisible killers. Within days, the patient's stump began to turn black. The sweet, rotting smell of gangrene filled the ward. Sepsis set in. The fever spiked. The patient died. Body count, 2. The surgical assistant, the young man whose only crime was holding a leg too firmly, suffered the same fate. The amputation of his fingers had opened a gateway for the hospital's bacteria. Gangrene consumed his hand, then his arm, then his blood. He died in agony shortly after the patient. Body count, 3. 1 spectator, dead from shock. 1 patient, dead from infection. 1 assistant, dead from infection. 3 lives extinguished from a single surgical procedure. A 300% mortality rate. It is easy to look back at this incident and view Robert Liston as a butcher, a reckless madman waving a knife. But history is rarely so black and white. We must verify the sources. While the death of the spectator is sometimes debated by strict academic historians as a piece of medical folklore, perhaps exaggerated by Liston's rivals, the core of the story appears in Richard Gordon's 1983 text Great Medical Disasters, and is referenced in holistically researched accounts of Victorian surgery. The deaths of the patient and assistant are entirely consistent with the medical reality of the time. And here lies the ultimate irony. Robert Liston was not a villain. He was, in fact, a pioneer. The 300% mortality surgery was the death knell of an era. It highlighted the terrifying danger of the speed above all doctrine. It showed the world that when you rush to save a life, you risk destroying everything around it. Just a few years later, in December 1846, Robert Liston would walk into that same operating theater at University College Hospital. But this time, he wouldn't shout for a timer. He would perform the first public surgery in Europe using ether anesthesia. When the patient woke up and asked when the surgery was going to begin, only to be told it was already over, Liston turned to the students, the same gallery that had once watched him kill 3 people by accident, and said, "This, Yankee Dodge, gentlemen, beats mesmerism hollow." With anesthesia, the need for 30-second amputations vanished. Surgeons could slow down. They could wash their hands. They could look before they cut. Robert Liston saved hundreds, perhaps thousands of lives in his career. He invented the locking forceps used in trauma centers today. He was a genius of his time, but history has a cruel way of remembering us. We are not remembered for the 1,000 times we walked the line perfectly. We are remembered for the one time we slipped. And for Robert Liston, that slip resulted in the only surgery in human history to claim a 300% mortality rate. If you enjoyed this dive into the macabre history of medicine, hit that subscribe button. Let us know in the comments. Would you rather take your chances with a 30-second amputation or no surgery at all? Sleep well.